Welcome. We are your team here at the Facial Nerve Center at Mass Eye and Ear in Boston. Have a history of Bell's palsy, Lyme facial paralysis, Ramsay-Hunt syndrome, or acoustic neuroma or vestibular schwannoma? Any transient insult to your facial nerve, the small nerve that makes your facial muscles move, can result in many long-term problems. We don't realize how important this nerve is until it gets injured. The good news is that there is so much that can be done these days to improve people's facial function, appearance, and quality of life.
We are here to outline a few of the tried and true treatments for what we call non-flaccid facial palsy. That's a term for when a patient experienced a period of no facial movement, where the eye won't close, the face droops, and there can be a stroke-like appearance, followed by obvious recovery, but swapped one set of problems when the face wasn't working at all for a new set of problems. Once the nerve begins to regrow and arrive back in the facial muscles, a new set of issues can arise for which patients are often unprepared. This is because sprouting nerves can arrive into the incorrect muscles which were not their original target, or they can overgrow into their target muscles. These things lead to a phenomenon we call wiskinezis, where when we initiate one expression, a different one or a mixed expression appears on the face, and to hypertonicity or tightness in the face.
So, in thinking about the patient with wiskinezis and taking a top-down approach, thinking forehead all the way down to the neck muscles, patients often find they still can't elevate the eyebrow voluntarily. So there's an asymmetry in the forehead, which can be especially noticeable in people who raise and lower their eyebrows a lot while talking. The eye, previously too wide, can become too narrow in a slit-like appearance, often with tightness, irritation, or even fatigue. Even though eye closure is possible, the fast blink can be weak, so that the constant clearing of the eye surface for moisturizing, protecting, and cleaning doesn't occur normally. People describe both wetness and tearing and dryness sensations along with discomfort. Moving to the midface. The midface can become very tight, sometimes with an obvious deep crease that can exaggerate the appearance of aging. Facial pain and fatigue are also very common. The corner of the mouth can be pulled upward or outward, giving the appearance of a smirk at rest. The smile can remain asymmetric, causing people to hold back their desire to smile, even when experiencing joy. The lower lip can continue to malfunction with a dimple appearing in the chin area. The lower lip sitting in an unnatural position where the lower teeth don't show when they should. And people are commonly unable to pull their lower lip away when saying words or sounds like E. This problem further distorts the appearance during talking, smiling, and laughing. The neck can become tight or pull inappropriately during normal expression. Patients can experience speech and pronunciation problems, difficulty eating and drinking, moving food around from one side to the other during chewing. This can affect socialization and the desire to appear in pictures. Both socializing and photos are the number 1 and 2 reasons that our patients come to seek help at the Facial Nerve Center. All of these issues, these impairments in facial dysfunction, can add up to a problem that severely impairs quality of life.
That is where a facial nerve center can really help. Evidence-based approaches to each of these functional problems include
physical therapy, also referred to as facial rehabilitation. An experienced physical therapist, occupational therapist, or speech and language pathologist who is trained in facial nerve dysfunction can perform a detailed evaluation and provide exercises and strategies to improve your ability to eat, drink, and speak, as well as improve your smile. The therapist teaches you how each specific muscle in your face moves to form facial expression. Then, teaches you how you can perform specific facial massages, specific movements to retrain your brain to improve your facial expression. This is also called neuromuscular re-education. Facial relaxation, stress management, and then really the commitment to the recommended home exercise program are important factors. Physical therapy is an effective first-line intervention because it is useful for patients to understand the nuances of facial muscles before other interventions are introduced. We think of facial rehab as the physical and mental piece, and things like Botox and surgery as the medical piece. Overall, facial rehabilitation initially feels like hard work and does take months, sometimes years of intense practice, but ultimately, this really pays off.
Very small interventions performed in the office can make a permanent improvement for people with facial palsy. Common procedures include removing a frowning muscle, the depressor anguli oris, or a neck muscle called the platysma muscle. Occasionally, removing a small segment of a lower lip muscle on the healthy side, called the depressor labii inferioris, can balance the smile significantly. Remember, all of these maneuvers are tested first by using local anesthetics or Botox to make sure that removing the muscle results in the desired effect before this more permanent approach is undertaken. Adjustments to eyebrow height and the upper and lower eyelids are also very straightforward and can make a big functional and quality of life difference. The important thing to remember is that if you are a person who has had transient facial paralysis and your recovery has resulted in some ongoing problems, there is definitely help out there. Our door here at the Facial Nerve Center at Mass Eye and Ear is always open. We can sometimes organize virtual visits, consultations, or educational sessions over the internet, and there may be centers locally that can help you. Visit us at www.facialnervecenter.org for more information.